So today's topic is asthma, and in next lectures we'll be discussing about the anti-asthmatic drugs. So let's first learn about the types and basically most importantly the pathophysiology. So once you will have an idea about the pathophysiology, then you will know that what are the chemicals or the immune system and how is it acting in the body in case of asthma. Then we'll also understand the drugs and their pathways in a better way. So that is my concern. That is why I took up the pathophysiology first, and in the next lectures, when we already know how the asthma condition is being triggered, we'll also know of how to combat the asthmatic condition. Right? So let's first of all say how many types of asthma are there. Either it is atopic or it is non-atopic. Either the asthma is atopic or non-atopic. So if I say that the asthmatic condition is atopic, that means this is caused due to the environment, that is the surrounding. In the atopic scenario, the immunoglobulins are being released systemically. And when I say systemically, that means they are directly released into the blood. On the other hand, the non-atopic, this is not a common type. This is not very common. And in this scenario, the non-atopic type, the immunoglobulins are being released locally. They are being released locally. When I say local, that is they are released directly at the site. This is not a common type. And when the immunoglobulins are systemically released into the blood, this is called as the atopic type of asthma, which is very common, which is very prominent. So now let's also have a look of, I'm just rubbing this of how the cells look like, of how is the mucous membrane present, where are these cells present. So if I say these are the lungs and I draw a normal diagram, I'll just categorize it like that. In the lungs, how the normal cell looks like, these are the smooth muscles. These are the smooth muscles. This is the mucus which is being released. These are the cells which are present. And this is the lamina propria. Right? On the contrary, when I draw a diagram of a cell, how a cell looks like, how a bronchiole looks like in the case of an asthmatic condition. So first of all, we will see that this is very narrowed because there is coagulation of the mucus along with all the other inflammatory cells that are being produced. It still remains the same. This is the smooth muscle, these are the cells, and this is the lamina propria, right? So let's look how these cells look like and these cells look like. Okay, how is the bronchiole looking, what is happening inside the bronchiole, how is the inflammation happening. So I am drawing a diagram here for that. Okay, so this is the basement membrane. These are the pseudo-stratified columnar epithelial cells present. We do have goblet cells present in a normal person with which are basic in number. They are responsible for the secretion of mucus. We all of us know that. Right? This is the basement membrane. Then we have lamina propria. Then we have the smooth muscles. Right? These are the smooth muscles present here. And here we have mucus, right? This is the pseudo stratified columnar epithelium, epithelial cells, right? This is called as the basement membrane, right? This is the basement membrane. These are the smooth muscles, correct? And these are the goblet cells which are responsible for the secretion of mucus, right? So in the lamina propria, this portion is called as the lamina propria. Here we have mast cells. The mast cells are responsible for secretion of histamine, correct? So this is how a normal bronchiole looks like, right? Now on the contrary, if I tell you the diagram of an asthmatic cell, how is that looking? So you will have a clear idea when I draw a comparative picture here. These are the smooth muscles. They actually become thicker in the case of an asthmatic cell. I'll tell you why. So here in the case of a asthmatic cell or an asthmatic person, first of all, the goblet cell, the number of goblet cells, they start to increase. Second of all, these stratified epithelial cell, they also become larger in size in comparison to the normal cell. I'll just make it larger so that it looks larger and you have an idea. Okay. Right. Second, in this case, the mucus secretion is excessive. The mucus secretion is excessive in case of an asthmatic condition. So this is a normal cell. This is how the cell looks like in case of an asthmatic condition. So yes. So the basement membrane, this thickens. There is the thickening of the basement membrane. The number of goblet cells, it increases. These are the goblet cells. So the goblet cells, they start to go up in number, which are responsible for increasing the mucus. Inside the lamina propria, the mast cell numbers start to increase. These are the mast cells. And then there is increased secretion of neutrophils. We also start to see here the entry of eosinophils. So eosinophil number increases, the mucus secretion increases, the number of mast cell increases, neutrophils increase, there's the thickening of the basement membrane, and even the smooth muscles, they start to show two conditions. One is hyperplasia and the other is hypertrophy. I'll just write it here. Hyperplasia and hypertrophy. So hypertrophy is basically the increase in size of the smooth muscle cells, and hyperplasia is increase in the number of the smooth muscle cells. So learn these two terms, hyperplasia and hypertrophy, which is happening to the smooth muscle cells. So their number is also increasing and their size is also increasing, collectively contributing for thickening of the smooth muscles, for thickening of the basement membrane, for increasing the size of these pseudo-stratified columnar epithelium cells. The mucus secretion starts to trigger because the goblet cells number increase and the eosinophils, they also increase, leading to there is mast cell increase also and neutrophils also increase. So this is the condition of an asthma patient. This is the condition of a normal person. So now let's see the pathophysiology of how is all this happening. How is what is the pathophysiology behind it? So I'll just keep that part and let's discuss the pathophysiology here. So one, there is I'm just naming few cells for you to have an idea of what we'll be discussing about. There is one thing called as IgE antibody. IgE antibody, right? And there is a cell called as mast cell. So one thing we already have learned here, that mast cells are responsible for the secretion of histamine, right? And now in the pathophysiology, we'll be learning about how the IgE antibody, it binds to the mast cell during the trigger of asthma, right? So this is the IgE antibody, immunoglobulin. The IgE antibody, the IgE antibody binds to the mast cells and there is the release of histamine. We'll also be learning about the eosinophils. We'll also be learning about the dendritic cells. Dendritic cells. So just to show that what cells would be involved, we'll also be discussing about the interleukins. We'll also be discussing about the cytokines. We'll also be discussing about the binding and all. So I've named few of the cells which will have a role to play in the pathophysiology of asthma. So I'm just rubbing this off. Okay. One thing is there, these are the, I'm just drawing the basic structure and then what would be triggered. Okay. There were a lot of goblet cells as I did mention, and these are the endothelial cells. So the endothelial cells, are responsible for secreting stem cell factor. They are responsible for secreting stem cell factor. This stem cell factor is responsible for maintaining the mast cell release. This is very important because if the mast cell will be there, we have already learned that the mast cell will bind to the IgE antibody and which will further trigger the release of histamine, which is responsible for the immunity or which is responsible as a defense reaction to the body in case of asthmatic condition. So endothelial cells are responsible for triggering the release of stem cell factor in case of an allergen. So I'll just tell you why all of this process is starting here. Okay, so this is mucus. If there is an inhaled allergen, that is inhaled, then what all happens? The first thing is that the endothelial cells, they will start to release stem cell factor, which will trigger the release of mast cells. Second, the inhaled allergen will be consumed by the dendritic cells. It will be consumed by the dendritic cells, which will further act as a, this will be activated. First, the allergens will be engulfed by the dendritic cells, which will be activated, and it will act, this activated dendritic cell will act as a chemoattractant. That is, it will attract the helper T2 cells. This is very crucial for triggering the asthmatic process. So I'll just rub this off and rewrite it here. Stem cell factor and the histamine release. So you do have an idea about this, that endothelial cells are responsible for the release of stem cell factor, which will release the histamine. Yes. So the allergen, it first of all is engulfed by the dendritic cell, which are activated, act as a chemotractant to trigger the release of helper T cell at the site, which is the lungs, the bronchioles, whatever is the place. Secondly, these cells also, they recognize the allergen. They recognize the allergen and they start to secrete thymic stromal lymphocyte. They start to trigger the release of, they start to secrete thymic stromal lymphocyte, right? And this thymic stromal lymphocyte further activates the dendritic cells. The dendritic cells are activated further, so that means this process is further activated, and again it leads to the triggering the release of, or attraction, I would use the word, it attracts the helper T cells at that site. So when the T cells are present, it starts the release of interleukins. Interleukin 9, interleukin 13, interleukin 14, interleukin 5. And everybody has a different role to play. Here, there is one missing feature here, the most crucial one, that is the mast cells. So I'll just remove these endothelial cells, you already have an idea. There is a release of mast cells, and we just learned that mast cells, they bind to IgE antibody, right? There is a mast cell IgE antibody binding, and this triggers the release of histamine, right? So this immunoglobulin 9 is responsible for stimulating the process of mast cell IgE binding to the which leads to the release of histamine. Interleukins 13 and 14 are responsible for so I'll just move it to this side of the board, that was very much occupied. So there are few factors which are acting in parallel in order to stimulate this asthmatic process. One was that these mast cells, they bind with the IgE antibody and they form a complex. So this complex was responsible for the release of histamine, right? This complex was responsible for the release of histamine. So this interleukin, the interleukin 9, this interleukin 9 is responsible for triggering the process of binding of the mast cell with the IgE antibody. So interleukin 9 is stimulating the binding of IgE antibody with the mast cell, and when this complex is formed, there is an increase in the release of histamine. So one, this process is happening. Second, there is a release of interleukin 13 and 14. So the interleukin 13 and interleukin 14 together, they trigger the plasma cells to stimulate the IgE production, right? And the interleukin 5 is responsible for increasing the release of eosinophils. These eosinophils are being released from the bone marrow, right? So in totality, if I say, what is all this leading to? All of this is leading to three things. One is increase in the release of histamine. One is increase in the release of prostaglandins. And the other is the release of leukotrienes. So So all of them, they trigger the immunity pathways and are responsible for targeting the smooth muscles. And this causes the smooth muscles to narrow. And when the smooth muscles narrow, there, in a technical term we call this constriction. And when it is happening in the bronchioles, we call this bronchoconstriction, right? Bronchoconstriction. So bronchoconstriction is happening, and that is one prominent symptom of asthma. So I am just rubbing all of this and creating a gist of whatever you have learned today. One, in case of asthma, what was triggering? The goblet cell number was increasing. So when the goblet cell number was increasing, that means mucus secretion will be increased. Then we mentioned that the stem cell factor released from the endothelial cells were responsible for triggering the release of mast cells. So the mast cell number also goes up, right? And then we say, right, the mast cell number goes up. Then we say that the dendritic cells are activated due to the allergen, and they were responsible for attracting helper T2 cells. It attracts helper T2 cells, which triggers the release of interleukin, right? And which in turn were responsible for the release of eosinophils. They were responsible for the IgE production, and immunoglobulin 9 was responsible for the binding of IgE with the mast cells, which were releasing the histamine, correct? Right? So this is what is happening entirely, and now I list down few of the symptoms seen in asthmatic patients. One, there is airflow obstruction. Clearly seen in airflow obstruction is seen. Then we see inflammation, and then there is broncho hyperresponsiveness, right? And what are the symptoms that you see in any person suffering from asthma? One is dry cough, right? Tightness in chest. Then there is wheezing sound, right? Wheezing is when you feel, when there's a sound in your breathing. Dry cough, tightness in chest, wheezing. And then we have dry cough, we mentioned shortness of breath. Shortness of breath, right? So that is it from my side. I tried to sum up the entire pathophysiology. If still there is any doubt, I'll just quickly sum it up. That in case of an asthmatic condition, the number of eosinophil increases, right? The mucus secretion increases. This was the small diagram. The mucus secretion increases. The basement membrane was thickened. The smooth muscle cells, they were experiencing hyperplasia, and they were also experiencing hypertrophy. There was an increase in the number of mast cells. There was an increase in the number of neutrophils. There was an increase in the number of eosinophils, and all of that was triggered due to the activation of dendritic cells. Dendritic cells were responsible for release of the interleukins, and they in turn were further stimulating all of this pathway, leading to airflow obstruction, inflammation, bronchohyperresponsiveness. Symptoms you felt were dry cough, tightness in chest, wheezing, and shortness of breath. So in this lecture, I have just summed up the pathophysiology. In the next lecture, I'll be discussing about anti-asthmatic drugs, their mechanism of action. So my most focus would be on the mechanism of action. I just discussed this pathophysiology, so you have a better overview of what is happening in the body in case of an asthmatic condition, right? Like, share and subscribe. Learn Medicine by Dr. Nikita, and let's meet in the next lecture for pharmacology. Thank you.